Next up, I would like to introduce Dr. Joseph Sangatu. Come on up. He's coming from the Solomon Islands and talking about being the first, and so we're really excited to have him here. Thanks.
Good morning, everyone. My name is Joseph. I'm from the Solomon Islands, and I'm one of the mentees for the third cohort as well. And my mentor is Dr. Esther Freeman. Today, I'll present about setting up dermatology services in the Solomons. It doesn't come with a guide, so we learn as we go along the way. And I thank you, and I thank GLODERM and Dr. Esther for the 1 year of mentorship that helped us to sort of strategize and see where we can improve better in service delivery for the Solomons in terms of dermatology. So just to give some enlightenment on where Solomons is, it is in this western part of the South Pacific, made up of 900 small islands, a scattered group of islands, mostly inhabited, and with 3/4 of the population living out in remote settings. We're still a least developed country, 25% living below the poverty line. So most of our challenges are almost similar to other countries as well, and is typical of the Pacific setting. Prior to 2023, there was no skin services. There was no dermatology services, so most skin conditions were managed and looked after by primary healthcare workers. And that is still the case. Most are still looked after by primary care health workers. But yeah, in 2023, after completing partial training at the Pacific Dermatology Training Center, I managed to set up our first skin clinic in the Solomons. And currently, we are offering outpatient services, referrals. We receive referrals from other departments within the hospital, receive referrals from other clinics in the peripheries as well, and from other colleagues throughout the country. We do some procedures, basic procedures, and yeah, we assist other programs within the Ministry of Health, such as leprosy and the neglected tropical disease programs. Since setting up, we also came to notice our own shortfalls, our own challenges, and once again, thank you to this GLODERM mentorship. It allowed us to sort of try to realize what are our gaps and challenges throughout the first few years of setting up the service. And with the hard work of my colleagues back at home and with my mentor as well, we've managed to sort of pick out some of the main challenges that we have. And listed here are some of them. We realized that we do not have a strategic plan for dermatology in the Solomons, and that is a key thing that we have to look into creating. And also, without the strategic plan, we are not allocated resources. We're still working as a subunit of internal medicine without any resource allocation. There's some shortfalls as well in our data collection and recording systems as well. Pathology services is a key challenge as well. Most of our specimens, all of our specimens are sent to Australia, and turnover time takes about 6 weeks when all is well, 6 months when we have backdated payments with the pathology unit in Australia. And in terms of drugs, we do not have most of the basic essential meds for dermatology services. And whatever basic ones we have, we usually supplied as well. And as much as we want to do telemedicine services out to our remote settings, connectivity has been a challenge. Staffing, in terms of staffing, we do not have dermatology positions within the Ministry of Health. And so the three of us working in our skin clinic at the moment are holding on to positions from other departments currently. There's no formal training support from our local government, and the two of us who had done some training in dermatology were mostly supported from outside donors and sponsors. We lack experienced clinicians. We have limited space with no inpatient facility as well. And we sort of realized we need to create functional relationship with other stakeholders, including our own hospital, our Ministry of Health, and other programs within the country. So over the last year, we sort of put together all this and thought about how we can move forward. And I think our future plan from here onwards is creating a strategic plan for dermatology in Solomons, trying to establish ourselves as a department in the future years, probably in 1 to 2 years' time, improve our data collection and create positions as well for dermatology, and try and get our government to support training as well. Long-term plans, we look at facility expansion and localized training in our country as well. And we would like to promote local research and expand access to care as well. And in the long run, making sure it is sustainable. So once again, thank you, Dr. Esther Freeman, and all the other mentors of the GLODERM and mentees as well of the GLODERM community. And thank you, Sarah V, thank you, ILDS, for making this opportunity a reality for us to share our stories as well. Thank you.